Hello, welcome to another episode in Yummy Data Science. And in this episode, we're going to talk about key concepts of enrollment data. It's also known as members data. So, this is a critical component of healthcare claims and healthcare administrative data analysis. Without members or beneficiaries or patients, as they may be called, there is no such thing as a healthcare system or healthcare encounter. So I'm going to be talking about two concepts when thinking about enrollment data. And talking about the concepts in the next video, I'm going to be showing you enrollment or member data, and I'll be showing you how to use an AI assistant in Google Colab to investigate this data and explore it and make sense of it. So the first concept is, well, how do health plans count members? Okay. So in our very simplistic example, we've got two people, ID 123 and 456. And ID 123 was enrolled from October 2024, and they are still enrolled as of January 2025. And 456 was enrolled in January 2024, and they left, went to another health plan, had a change of job, and went to another health plan in May. So this might be what an enrollment data looks like, right? But how are health plans going to save it and store it so that it is ready for analysis? And before we talk about how they're going to store it, let's talk about what analysis are they may be thinking about. Well, they may be thinking about, well, what is our cost per month of providing care for our members. So, what's our inpatient cost? And every time you talk about cost and utilization, there's a time element involved. You're not going to talk about cost without saying what's the time frame. So, you might be saying inpatient cost per month or ER visits for quarter one of 2024. So, in the same way, members are counts of member months. So if our first member, ID 123, has been there since October 2024, they, for each month that they were enrolled in the plan, they would get a row. So that's why in the next table that you see that I've titled member months, you'll see 123 appears in the first row, which is October 2024, and now it's been converted to member months. So, because now we've got members converted to a unit of time, and we've got cost and utilization, which we always think about as a time frame. So for comparative purposes, one health plan could make a claim that our inpatient cost per member per month is lower than yours. And that's where we're going with this. So most health plans will think in terms of member months rather than members. Another key concept that is associated with member data or member month data is continuous enrollment or eligibility. And these are a little bit same terms, and I'm almost using them synonymously because in this instance they mean the same. But they could be slightly different, and I'm not going to go into their differences right now. Well, why is continuous enrollment important? Well, first of all, what is continuous enrollment? Well, the definition would be, say, if a member is enrolled in a health plan for a specified period of time, usually 1 year, then we can say that member was continuously enrolled for 1 year. And sometimes they'll allow for gaps, and they'll say, okay, you have to be continuously enrolled, but a gap of 45 days is okay. We're not going to go there yet, but I just wanted to throw out that concept. Now, why is continuous enrollment important? Think of a cholesterol management study that has a certain duration. So you do the study for 2 years. So intuitively, you would want your members to be in the plan during the duration of the study to be counted, right? So that's why the studies for 2 years, you'd want your members to be there for the 2 years. So you could figure out whether your interventions with respect to their cholesterol management are being effective or not. So that's a very simple explanation. Now let me give you a little bit of a more meaty and long-winded explanation. And if you want to stop the video and you got the concept, feel free to do that. So let me talk about quality measures. Health plans are evaluated on key quality metrics. How are they delivering healthcare? And these are governed by a number of bodies, but the most important one is HEDIS. And HEDIS is a part of the National Committee for Quality Assurance, and over 90% of health plans report quality metrics using the HEDIS system. One example of a quality metric is colorectal cancer screening rate. And I'm picking on that because it is easy to think about. It is relevant for a large number of the population, those who are 45 and above. And it is a cancer that is a leading cause of death in the US. So if you think about colorectal cancer screening rate, and you're thinking about what it means percentage of members aged 45 to 75 years who had an appropriate screening for colorectal cancer. Well, then in the denominator, what you're going to be thinking about is members with continuous enrollment. Okay. And the way that this measure is defined is that you look at the current year, the measurement year, and you look at 1 year prior. So the continuous eligibility or enrollment requirement is that they be continuously eligible for the measurement year and the prior year, but a gap of 45 days is allowed. So that brings in the concept of the gap. And the exclusions to the denominator are that any members with a previous history of colorectal cancer or a total, or a procedure where everything is taken out surgically. And now that we have got the denominator and we have, after doing all these appropriate exclusions, we don't want to count the people who have had colorectal cancer because, that's not relevant. They are not going to get screened anymore. Now, so once we've got the denominator, then we take that cohort of people and then we look, well, have you got the appropriate screening? And there are several screening methodologies. And so you can see if the health plan gave them those tests. And then you have the numerator and you can divide the two and you get the ratio. So the continuous enrollment is also intended to give health plans sufficient time to provide appropriate care. And in this case, for the colorectal cancer screening rate, we are saying that the person needs to be have continuous enrollment with an allowable gap for the measurement year and the year prior. And you could argue, both ways, whether that's a good thing or a bad thing, but this is how HEDIS is and quality metrics are done. And this is how studies are also thought about. And so continuous enrollment is a key concept in medical studies. Thank you for listening. Now let's go over and look at the data, enrollment data.